What's up, guys? Today I am at the hospital going to do my monthly visit with Dr. Pettit, my oncologist, and I've set up a interview for us. So I got some questions that I've gotten from some of you guys. We're going to go over some of those. Hopefully it's a good interview. I might do a quick walk through the hospital depending on what I can get. Sometimes they're a little weird with it. And I hope you guys like it. Please subscribe down below, wherever it is. I would really appreciate it. And I know other people that are looking for help would also appreciate it too. Kind of helps out with the algorithm. So go ahead and do that. Give it a like, and I hope you enjoy it. Thanks, guys.
Hi, I'm Dr. Pettit from University of Michigan.
Yeah, that works, I guess. Yeah. I'm also learning how to edit these things too,
Okay,
because I don't know how to do that.
good.
Yeah. So one of the bigger questions is people are wondering, should their family members be tested?
That's an excellent question, and I think is still an evolving answer. Maybe 10, 15 years ago, the answer to that question would have been no, that MPNs generally do not run in families. But we've learned a lot more over the last, really just the last few years or the last decade, that these sometimes do tend to run in families. And we don't fully understand how that happens. The JAK2 mutation does not tend to be directly inherited from parent to offspring, but there are probably a combination of different factors that make people in the same family more susceptible to developing these mutations. We don't fully understand that yet, which makes it difficult to test for that situation. So there's no formal testing that's recommended in people's families. But I think it is important, if you have an MPN, that your family members know what your diagnosis is and that their doctors know what your diagnosis is, so that if you do develop any symptoms, that if your family members develop any symptoms that seem consistent with that, that they can have that on the list of possibilities.
Okay. All right. And then along with that, I know diet. A lot of people, and plus going into dietetics and everything, a lot of people are wondering about diet. Is there a specific diet that we should be following?
Yeah, there's not enough research out there on that, so I hope you're interested in it.
That's what I'm trying to do, yeah.
Yeah, there's not enough research out there. There is a study that's going on out in the University of California and also in Texas. They're doing a study of kind of an anti-inflammatory diet in people with MPNs. Which is nothing crazy. It's basically a Mediterranean diet, a lot of fresh fruits and vegetables, not processed sugars, that kind of stuff. And they're checking people's energy levels, their symptom scores with MPNs, and some of their inflammatory markers in their blood over time to see if there's improvements. So stay tuned for more results on that. They put out just some preliminary results that have shown some improvements. But yeah, improvements in both psychological and physical manifestations of the diseases. So I don't think anybody's expecting that a diet is going to cure the disease by any means. But as far as improving quality of life and improving symptoms, I think there's probably a real role there for a lot of people.
For sure, yeah. I know, with diet, I've found out that it affects brain fog, and a lot of people are wondering what else you can do, because brain fog, short-term memory, or just that haziness, no matter what, there seems to be, the more carbs I eat, it seems to, I get that more. But that's probably just me. I'm not sure.
I think everybody's different, but I think that's a really good observation. That the brain fog can definitely go along with, I think, inflammation in your body, which diet plays into that, exercise plays into that, sleep plays into that. And I think a lot of the psychological aspects of the disease too, so depression and anxiety that go along with MPNs, I think that those are symptoms that are potentially modifiable by diet, exercise, sleep, those kinds of things, at least to some degree. So I think lifestyle can definitely play a role.
All right.
Yeah.
I meant to write her name down, I forgot. Is shaking a symptom?
Shaking, being
Yeah. A couple
tremulous.
people have said that there's these tremors or a shaking or something like that. I don't know.
So tremors themselves aren't super common symptoms that we hear of, but as you know, these diseases are so different for everybody. I mean, definitely like tingling and neuropathy we hear about a bit more. Tremors I'm not so much sure about,
Right.
unless they went along with maybe like an anxiety sort of thing. But nothing is off limits with these diseases.
Yeah, I know I don't shake, but I do get neuropathy.
Yeah.
Pretty bad, like with cold or sugar, like there's triggers.
Mhm.
Is there anything we can do for that?
Yeah,
I know, like it's obviously person to person, but
yeah, definitely person to person. I think some medications can definitely help with that. I think so. The neuropathy is one of those things that I think sometimes people don't notice or don't associate with the disease until they're actually asked about it. So
Right.
sometimes it's a type of thing where we start a treatment for an MPN and people say, "Oh, I didn't really realize how bad my neuropathy was until it started getting better
Yeah.
with the treatment."
That's exactly how I was. Yeah.
Yeah. So I think some treatments like hydroxyurea, interferon, Jakafi, some of these things that lower inflammation and these inflammatory cytokines and improve circulation throughout the body can help with those sorts of symptoms
Oh, nice.
a lot.
And then the last one, I wasn't sure if I was gonna. It's a weird one. So I've been getting people wanting to know about like CBD and like medical marijuana stuff.
Mhm.
A lot of it seems to be more for like for sleep, bone pain. That was also like my leg. I wasn't sure if that's what it was because I haven't felt it forever. But like it wasn't. I don't know. It felt different. But I guess, is that something you would recommend? Obviously, you know, like legalities or wherever you are. Is there any positives to it from a medical standpoint for, I think a lot of like sleep, bone pain, and nausea were the big ones.
Yeah, I don't know of any medical studies that have shown any benefits, at least, or that have been well done,
Right,
that have
yeah.
shown or denied any benefits to
Right.
things like CBD or medical marijuana for these particular disorders. But I think it's different for everybody, like you said. If there's something that helps with anxiety or with sleep or with some of the symptoms related to the disease,
Right.
helps give you more energy during the day if you can sleep better at night, those kinds of things, then I think for some people it could be helpful. But I don't have a lot of data to back that up.
Yeah, I don't think there is any.
Yeah.
It kind of seems like it's just like getting thrown out there.
Yeah, for most situations though, there's probably not a whole lot of a downside. I mean, you've got to be careful if your immune system is suppressed about, I think, going into dispensaries where that things like molds could be like
Right.
aerosolized. But I think CBD, that's not such a big difference.
And then
Difficulty.
last question is the biggest one that I've gotten, the vaccine.
Mm-hmm.
Is that, because I know, like my fiance, she got it, the second dose, 24 hours knocked her out.
Yeah.
You know, like she was like in a bathtub crying in pain. It was horrible. But I've also known some people don't have any reaction with us having, you know, like, I'm not really educated on it, but is it something that we should have now or wait till like the second round that comes out? Because the whole mRNA vaccination and the second one, I guess, is different. Is there, yeah.
Yeah, I mean, I would definitely encourage people with MPNs to consider getting the vaccine as soon as you can, as soon as it's available to you, if you feel comfortable getting it. I think there's a definite risk of COVID infection in MPN patients with blood clots for sure, and with having the extra cytokines in your body to promote inflammation in the lungs and things like that. We are worried. We have some reports of worse outcomes in people with MPNs who get COVID infections. So for that reason, I think the vaccine's really important once people are able to get it. I haven't had enough MPN patients to get vaccinated yet to have a real good sense of whether or not they feel worse with the vaccine than other people. I think it's really kind of across the board, really variable though. Some people have absolutely nothing. Some people have some fatigue and aches and things like that, like you said, for about 24 hours afterwards. I think it's worth getting, in my opinion, and I think the best vaccine is the one that you can get in your arm. So I think of the now 3 that are available, there's a 3rd available now. I think all of them are really effective, all of them are really safe. I think I don't have a preference between any of them. I would just get whatever you could get.
All right, cool.
Yeah.
That's it.